Hey, everybody, this is Dr. Jess. We're going to be talking about a new subject today, and that is breast implant illness. Breast implant illness is fairly occult, if you will. It's one of the reasons that a lot of women suffer, and they don't know why. And today I have as a guest Emma Thompson, who has gone through this and come out the other side and is living her life again. And she's going to tell her story. And I think you guys should listen because this is one of those things where the doctors keep telling you, no, it can't be that, it can't be that, it can't be that. And it happens to be that. And frankly, it's not one of those things that you get the implants and you're ill immediately. This can happen immediately. It can happen 6 years afterwards, 12 years afterwards. There's loads of reasons for that. It can happen if you happen to have the full silicone implant. It can happen if you have the saline implants because you have the silicone shell. Okay, so this is a story you want to listen to. Emma, thanks a lot for coming on the show today because I know you're sharing an intensely personal thing and you're doing it for the right reasons to let everybody know what the heck happened.
Yeah, I mean, just sharing my story on social media. Last year, I was absolutely inundated with women who had breast implants, who had the same symptoms as me. So, everything I've shared has been public. I've got a private profile. I literally wanted it to get as far as possible. So, I'm more than
It's
happy
good. It's good of
to
you to do
share it.
that. So tell us a little bit about your life before you got ill, so people have a kind of a gauge. Because I know you're an athlete, you're a high functioning woman. You're what you always amaze me. Like I'm going to go swimming, I'm going to do this, I'm going to do that. I'm like, okay, okay. Tell us a little bit about yourself, and then when you got ill and the course of it. How what kind of symptoms you had, how it was fobbed off on whatever after what they considered appropriate testing, stuff like that.
Yeah, so I mean, my young years, I was actually a professional DJ. That was my full time job, and I travelled the world DJing in clubs and festivals, and literally living the dream. Really, I got breast implants in 2006 when I was 23. Um, a few things happened in between getting ill that I had no idea were related to anything, but now knowing what I know about breast implant illness, I do know that they're correlated. So the first was about 3 years later, my anxiety got so bad that I was put in hospital for a month. That was just that was 3 years, yeah, pretty much bang on 3 years after they went in. My skin started to really change. I had a lot of spots all of a sudden, which was put down to the medication that I was on from hospital. But it was there before then. Really, really bad. I'd never had bad skin, and I really aged. So around 29. So I went from looking like a young person to somebody with a lot of wrinkles on my forehead. Nothing, I didn't think anything of any of it really. I didn't think anything was linked. So those were just things that were happening in the background. Um, and then when I was 29, I was on the radio at the time. I went on tour to India. I was DJing in India. I had 3 gigs in 4 days, and I was just asleep that whole trip. I literally could not enjoy that trip at all. The guy I was DJing with has got loads of videos, and all the videos I'm asleep. I was literally only awake to DJ, and that was it. And then when I got back, I was feeling pretty bad, and I went to the doctors, and he said, "Oh, well, it might be that your glandular fever's reactivated." I think there's a word. He said, "We can't tell whether this is old or new, but it might be that." I was like, "Okay." And then the next thing, I was in my house alone and I just started collapsing. I couldn't stand up. My legs were going from underneath me. I thought I was having a stroke. I really did think, I thought I was dying. I rang my mum to say, so there's something really, really, really wrong. Like, I think I'm dying. So my mum came and got me and took me to hospital, and I couldn't walk at all. I was in hospital for a few days. They did a load of tests which showed nothing, as per. And I left that hospital. I wasn't able to walk from my bed all the way out. Big hospital. I was in a wheelchair, and that was it really. That just started this absolute nightmare of just having no life really, struggling to walk, struggling to think straight, seriously not able to recall things or get words. I felt stupid overnight. I just felt like I'd become this stupid person who couldn't articulate anything. I wasn't able to brush my hair because if you think about if you go to the gym and you do some weights, by like the 12th rep, you get a burning sensation in the muscle. That was happening to me after 2 brushes of my teeth, after a brush of the hair. I had to shower sat down because I couldn't stand. I had to get an automatic car because I couldn't change gears because my arms were that tired. I was struggling with the clutch. And that was it, really. I was sleeping 20 hours a day, and just told that really there was nothing coming up significant in the blood. I went to see a specialist, and I think at that point I did see an endocrinologist who noted some abnormalities in terms of my hormone production. But again, that was just, well, we don't really know what that is. That's all I got told. This is a specialist as well. He said, oh, we're not really sure what that is. You've got chronic fatigue, and that can happen. So, that was a
It's
diagnosis
interesting. What diagnoses were you given?
chronic fatigue syndrome, which was the worst diagnosis I could have got, and it was the one that I feared the most. But to just kind of be told, sorry, there's no reason for any of this, it really sent me to a very dark place. I think at the time my understanding of chronic fatigue was I didn't understand what were they saying, that it was imagined, and that caused a lot of stress as well, because I was thinking, this is not imagined. I can't move my arms. But I mean, later I understood that was never what they meant. They meant that their interpretation of it is that the body is causing the symptoms, but there's nothing wrong. The brain, sorry. But either way, that just didn't sit right with me either. I just thought, there's no way that there isn't something hugely physically wrong with me. But I didn't link any of the stuff to do with the skin and the anxiety at the time. But yeah, that was it then for me for years. I was unable to do anything at all. I wasn't able to exercise, train, walk my dog. I couldn't walk my own dog. I had to have time off work. I couldn't do an hour's work without needing to then have a sleep. And there were times, of 20 hours a day I was asleep in the bad times.
How was your anxiety level during that time?
Yeah, quite bad. There was lots of palpitations, but neurologically, I've learned why it was so bad. My anxiety just got to very obsessive levels, of very obsessive thoughts, but constant. And I think some of that is part of being extremely inactive, unhappy, miserable with your existence. But some of it, because that was, as soon as I had them out, my implants out, that went. And a lot of the ways that I was viewing everything from interactions with people, misinterpreting, perceiving things to mean things that they didn't, and sitting for hours going, they just said this to me and it means this, and that all that just went. So I have struggled with anxiety, but after they went in, hospital and needing to be on medication and all of that stuff, and then when I was ill, it was quite bad when I was ill. Not all the time, because sometimes I was just too tired to be anxious.
This is for everybody. Remember that anxiety has a stigma attached to it. What we're speaking of here is anxiety, what you feel, but it's caused by something in the body, which is the main reason for most anxiety. And what Emma just proved very clearly was, when that root cause was removed, the anxiety dropped, which means the excitation in the nervous system dropped significantly, and the whole cascade of OCD and racing thoughts and all those things that would keep you up at night, saying, because you have the feelings, then you have to backfill in rationale. What we tend to not believe as doctors and practitioners is that those anxious feelings have a base and have an actual root cause that can be corrected. Okay, so go ahead.
That's so true as well, because what I have learned, my illness was a gift in some ways, because I really had to meet myself whilst I was in that state, and really go to some quite dark places and find my way back. And one of the things that I learned in that process was that anxiety is just an emotion. It's just a feeling. It's the chatter that goes with it that creates all the distress. So even now, if I have any wave or anything, I get into my body, I feel the anxiety in my body, and I switch off the voice, and then it's not distressing. But when you're constantly narrating what's happening, that's where the distress comes in.
Absolutely, absolutely. And you're like my hero, because you've taken, even before you had the implants out, you took these very, very difficult emotions and mastered them, but they were continually assaulting you, and you
Plaguing.
had, they
Yeah,
were
yeah.
plaguing is a good word, and you had to bring in those tools all the time. What was the hardest part of all of this?
I think the hardest thing for me, I mean, that was 7 years, and this is going to sound extremely dramatic, and I don't want it to be insulting to anybody who has had a different experience. But for me, it was just this is it. There is no way to feel any better, and it doesn't really matter because you're not dying, and you're not, you're not gonna, you don't need any medical attention. So it's okay that you have no life whatsoever. And it was that never-ending kind of, but always waiting. It was like, because it wasn't anything, what's the word? It wasn't anything terminal, or it wasn't anything that, you could at least tangible. There was nothing tangible about it. So you just felt in complete no man's land forever, whilst remaining hopeful that one day you might feel okay, and nothing changed. So the hardest part for me was the emotional turmoil and torture of just begging and praying that it would be different, and it just never being different, but never having an answer. And what I mean by not wanting to insult anyone is that I literally said to people that I loved, I would rather somebody said to me, "You are terminally ill,"
Right.
and I at least had a way out or something. Or
Yeah.
even if somebody said to me, "You've got cancer," I wanted that, because I thought, you know what, I'll fight it. And if I can fight it and recover, I will. And if that's the end for me, that's the end. But I cannot live in this cycle forever. I physically can't do it. It was too painful. So it was the emotional torture that came with it, with losing everything that made you you, and you felt like you had nothing to offer anyone, and that was a very dark place to be.
You said it very, very succinctly. Really, you went from being a functional member of society to a disabled individual who required care. And the worst thing was, you didn't know what was wrong, but you did know you weren't going to die from it. And you were looking at a very long life of
Yeah.
pain and disability.
And another thing I said again, which, please, I hope nobody takes the wrong way, is I also said I would rather be paralyzed from the waist down, and at least just have, and that probably wouldn't be true if that happened to me. I'm just giving you my mindset. I just thought at
Of course.
least then I'd accept it at some point and go, okay, you know what, I'm going to be successful in this instead, because I can't do this. But with what was wrong with me, I couldn't do anything. I couldn't function. I didn't have anything that worked. So yeah, I almost was prepared to lose limbs in order to just get some of me back working. And I know that's so dramatic, but that was where my
No,
head was at with it.
it's an honest mindset. And I believe that there's a
Mm.
lot of people out there who think and feel that way, but wouldn't actually mention it to anybody, because it
Because
almost sounds
yeah,
like a suicidal intent or suicidal ideation, and that they don't want to be viewed as that. More than that, they don't want to be viewed as a psychiatric case,
yeah, for
because that's
sure.
often the way this is fobbed off. At
Mm.
some point, things started changing. I know that we started working together, and some of the work we did changed, improved things somewhat.
Hmm.
When breast implant illness, there's no really good testing for it. Okay, you can test for, antibodies to silicone, but that's not exactly accurate. All the other testing has to do with chronic inflammation. I guess the most accurate test would be thermography. How did you come to the realization that if you didn't have the explantation done, nothing would change?
Well, for me, as soon as it was put on the table, I was just prepared. to try. I didn't care. You know, I had seen glimpses of my life coming back with the work I'd done with you. Clearly something was happening to help with either inflammation or the gut or whatever, and I was getting glimpses of my life back. So what was happening was, every time I crashed, once I got a glimpse of my life back, you'll know, I was on Zoom to you in tears, like demented, absolutely demented, because you just get that hope that maybe that's the last time, and you, oh God, I feel sick even talking about it. But obviously we'd done a lot of eliminating of other factors, and we'd worked on, you know, lots of things that, you know, there was deficiencies and there was improvements. And when it came down to, okay, there's nothing left now, I literally booked an appointment that day to speak to a surgeon who specializes in BII. She's called Dr. Kappel. She's based in the Netherlands, and she's the most incredible woman. She has been fighting for women with this illness. She has been vilified and ostracized by the medical community because of what she's doing. And
we can always tell who the pioneers are. We can always tell who the pioneers are, because they're the ones with the arrows in their backs.
Yeah, absolutely. She's took a lot of shit, excuse my French. But basically I spoke to her. She knew that my implants had been in 14 years and I'd been ill for 7. She said, I've done an autopsy on somebody whose implants were in for 16 years, and it was that killed them. You know, I did the autopsy, and I could see how much silicon per whatever there was in the blood, in the tissues, the reason why you have brain fog, you've got silicon molecules, the reason why this happens. And I just went, book it. And that was it. I booked it that day for, I think we were in the middle of a pandemic at the time. So I had to, you know, there was no question in my mind of, oh, I might be at risk. We knew that my white blood cells were really, really low. Yes, I didn't care. I honestly didn't care. I didn't want that month waiting for that operation, or 6 weeks, whatever it was the longest time of my life. But I just knew, I knew I was going to be, I knew that was what it was. As soon as you said it, something just went click, because it had happened to a friend of mine who'd had cancer, and she was told by her doctor, oh, we'll reconstruct for you. And she said no. And he said, no, you know, you need to look like a woman. That was what this guy said to her. And she went, oh, okay then. And she ended up nearly dying from the breast implants. Exactly. So that was it. It was done. And, you know, the next few weeks were difficult. You know, I was scared. My body was in a bad way. I was scared about having anesthetic, and I was frightened about how I was going to look. But at the same time, I would have, you know, at the same time, it's funny, you can be fearful of how you're going to look whilst also not caring at all, because there is nothing that they could have said to me, you're going to look deformed, you're going to be inverted, you're going to have to do a mastectomy. Nothing that they could have said would have made me go, okay, no, I won't bother then. I'll just see if it's something else. I'll just see if it's something else. I didn't even care if they did it and it didn't turn out to be that. I needed something to hold on to. So it was a no-brainer for me.
And when you had the explantation, I remember the emails that you sent me like that night, and subsequently, the major symptoms, anxiety symptoms, were almost eradicated. As I remember, yes.
Yeah, I mean, the first day I had a lot of anxiety when I first came out of surgery. But you explained to me, because when I opened my eyes and the rest of that day I had a lot of palpitations, and my first thought was, oh no, that's not gone. That was the thing I wanted to go the most, because my anxiety was so bad towards the end because of the cortisol and the fight and everything that you explained, that I was disassociating. I was looking at my partner and thinking, I feel like I don't know who you are. Same with my dog. It was horrible. It makes me anxious even thinking about it, but that was just pure levels of inflammation. So when I was really anxious that day, I did have a panic, but then I got some morphine and that went away. But then the next day I was okay. That was just anesthetic. So the things that noticed straight away, first of all, I've got a picture from the day I came out, and the lines on my head the day after because I'd been photographing, the lines on my head had reduced drastically. Dr. Kappel explained that it's to do with hormones and silicon and stuff, why you age. So that's what I referred to earlier on. That was, I mean, after a week, I probably looked 10 years younger.
I remember.
My skin cleared up pretty much straight away. I had, towards the end, I had really bad like spots and acne all over my chest because of what was going on in there. And that cleared up right away. I could sleep. I didn't have the palpitations in my chest. And I just felt clearer. everything was not so foggy, and I wasn't obsessing, and I didn't have that burning sensation in my arms and legs either. So that was all within a couple of days. I just had a 5-hour surgery. They have to remove the capsule, they have to scrape off the ribs. It's painful, and I was walking better than 2 days before they were out.
That's amazing. That's a tribute to the body and its ability to heal and its desire to heal. You know, the not difficulty that is, but what I see with breast implant illness patients who have the explantation that is done correctly is that they genuinely or generally feel better, but often they'll get a small issue like a small virus and they'll crash again. What you did that was different is you did a bunch of work beforehand as part and parcel of what we were doing together. We were doing foundational treatment, trying to get your cells working, your gut working, getting your inflammation down. And then when we ruled out everything else, this is what was left over. And as Sherlock Holmes would say, okay, when you rule out the impossible, whatever's left, however improbable, must be the truth. And you're the poster child for that. But your post-surgical course was good. You're now, you know, living your life. You had some dips. Okay. Tell us about how it was since the surgery till now.
I've only had one dip, which was probably a couple of weeks after surgery, which lasted about a week, where I just slept more. But I wasn't even 6 weeks out of surgery. I was 2 or 3 weeks out of surgery. So, you can't really, and that was it was a big operation.
Mm-hmm.
And, when she showed me the implants, they were maybe half full from when they went in. So that is a lot of crap in my body that has bled into the system.
Absolutely.
So I didn't actually expect to be as good as I was. 6 weeks, I waited 6 weeks until after. I'd been on a zero inflammation diet for a month before and a month after. So no wheat, no caffeine, no sugar, no alcohol, all that stuff. I really, really looked after myself. And then within 6 weeks, I was back training. And that was purely to recover from surgery.
Mm-hmm.
And so from July or from August to now, I'm back fighting. I'm back doing Muay Thai. I'm in the sea. I'm doing 10K runs. I couldn't even walk a kilometer. And I've just today signed up to fight in November in a Muay Thai show. So everything that I couldn't do before is back, and I can think straight, and I'm happier. One of the things that is, and obviously circumstantially you're going to be happier when you can move, but at the same time
it's right down to the cellular level. If you're not
the difference
producing
up
all that
here,
nastiness,
yeah,
it is.
yeah. And anything that comes now, I'm really able to deal with it, not obsess over it and make it big. I'm just able to allow myself to feel and move on. And I've done a lot of work on that as well. But before, it was very difficult to do because of the constant chatter, the constant. And now it's just not like that anymore. So I've really noticed how insane it made me. They made me neurotic and obsessive and a bit insane, and probably very difficult to be around, actually.
A lot of women are suffering. A lot of women are suffering. You know that my practice is made up of those people who've been here, there, everywhere, and cannot find out the reasons for their illness. And even if they know the reasons, they haven't gotten the proper, or let's say successful treatment. And I'm usually, fairly successful with it because I think about things in a different manner. But for these people who are suffering, what do you feel needs to change in relation to not only breast implant illness, but illnesses like chronic fatigue and fibromyalgia? What needs to change here?
Well, the breast implant illness thing is easy enough. It's just education. I actually wrote to our health board here where I live and said, you need to get GPs before they give that diagnosis to women to ask them if they've got breast implants. Here's a load of stuff. And they said, we're going to do a campaign on it. And I also wrote to Public Health England and asked them to do the same. They said, we're really interested in this. We want to speak to you. Obviously, they're in the middle of a global crisis at the moment, so it's not top of the agenda.
Things have to be in a priority. Let's face it.
Yes, exactly. I'll give them that one for now. But really, that's quite simple. That is just a question from your GP before you slap that disgusting sting, go away diagnosis on somebody, on a woman, have you got breast implants? So that's easy enough. To do with the mentality around things like chronic fatigue and fibromyalgia, I just don't think that we can continue to give anybody that diagnosis, because you are literally destroying that person's life forever. I rang the ME Association before, when I was ill, and asked for advice. And do you know what they said to me? You need to accept that you're going to be ill forever. You need to take time off work. Your family need to truly understand how much, you're going to need support, and you're just going to need to fully accept that this is your life. And I went into such a dark place after that. And now that I know, these illnesses don't even exist. They're sets of symptoms, and there are ways to find out what is going on. And just because you're telling me that my thyroid is in range, but if it's high, and now you don't want to do anything else about it. No, I had an endocrinologist say to me, yes, you've got no hormones. We don't really know why you've got no estrogen. It's probably CFS. That's not good enough. It's not good enough to say to somebody, sorry, we don't know why. So there needs to be so much education around this, and to stop giving people, you are destroying people's lives. You have got no idea what it's like to live with that. And I get people have chronic conditions that you can't recover from, but this isn't one of those. This isn't motor neurons or something that's you can't come back from. You can. So stop fobbing people off. It's got to change, because it really hurts my heart when I see people suffering with these illnesses. It's painful.
Me too. I'd like to clarify for the people listening. When Emma said that fibromyalgia, CFS are not diagnoses and they don't exist, what she's saying is that accepting I'm going to use fibromyalgia as an example, as a diagnosis means that is the cause of something. The word diagnosis means an estimate of the root cause of an illness. Fibromyalgia is pain in the fibers and the muscles and so forth. Before, a couple of decades ago, before someone was labeled with fibromyalgia, they had what I like to call the $1 million workup done. The doctors would check everything, thyroid, anything they could think of, and it was a diagnosis of exclusion. Ever since the American College of Rheumatology came up with a criteria for diagnosing fibromyalgia, which was just, how many painful points there were and so forth. All of a sudden, that long investigation stopped. If people fit within that criteria, they were labeled with fibromyalgia, given a medication. Here's the problem, people. When you're labeled with something, CFS, ME, fibromyalgia, autoimmune, whatever, when you're labeled with something, the investigation stops. And the fact is, if you've developed something, and you weren't born with it, if you developed something, there's reasons for it. And you have to keep going back and keep finding the reasons. And not only finding the reasons, because sometimes if you get at the root cause, chronic Lyme, whatever it happens to be, and you don't fix the body's ability to heal itself, the body will still maintain the symptoms, even though the root causes are gone. So it's kind of it's called a cell danger response. You have to treat it from two different directions. Nevertheless, if you're given a diagnosis like chronic fatigue, fibromyalgia, or any of the other ones that I can think of that basically say, well, it stinks to be you, here's your medicines, here's your disability stuff, but you're going to have to live like this. Whenever you're told that, that's a signal for you to say, let me start looking for somebody else to work with, because you can almost guarantee that there are other answers or things that haven't been. Go ahead.
The most upsetting thing about that, though, is not like I am by nature an incredibly resilient and strong person, so after a couple of years of being unwell, I went on my own discovery journey, because I refused to accept it. And I did get well for a short time by removing inflammation from my diet, and it did give me a break, and then I crashed again. But if the second time I crashed, when I thought I was better, was even more heartbreaking, because I thought I'd nailed it, but I still didn't accept it. And not everybody is like that. Lots of people just like, well, the GP, I should say, says that this is what it is, so this is it. I accept it, and I feel for those people, because it's not their fault that they don't have that fight, or they don't actually understand that there might be something that they can do. And it's those people that we need to get to, those people that are sat in their house for years, I
It's a
don't
matter
think
of
it's the same.
education, and
Mhm.
empowerment is by education. And this is one of the reasons that people listen to your story. They realize that perhaps I don't have to live like this. And
Yeah,
that's the beginning of their healing, when they realize that this is not them, that something is causing this. We
of
had
course.
spoken a bit about a charity that you're setting up. Could you tell us a bit about that?
Yeah, it's going to be called Not Me, Not
Not
Me.
Emmy?
So yeah, so basically, no, this isn't happening to me, but also it's not Emmy. Basically, that's the play.
I like it. I
So
like it.
I've had a logo done so far, and I'm just applying to get it registered and things like that. But the aim of it really is going to be to educate as much as possible on what is really happening here. You know, like, I'm glad you clarified. Obviously, I don't mean it doesn't exist. What I mean is that it's a set of symptoms. There is always going to be a cause. We can find it if you can be bothered. So really, just to give people hope. I spoke to a number of people recently who just have been living that life, and even just me telling them that they can be okay has just ignited this fire in them.
Exactly.
And that's
Exactly. That's
all.
great.
You know, it's up to you then. If you don't have the strength or the will to put in the work and really get better, you know, then that's fine. But I just want to have a platform where people can understand that there is a way out, and then ultimately to raise funds as well, because a lot of people in this situation would not be able to even afford to buy vitamins because they
Right.
haven't worked, they
Right.
can't work, and it's expensive. So ultimately, to raise money to pay for treatment, you know, with functional medicine people, to pay for their tests, and
Right.
to pay for their subsequent, you know, bits that they need, which are expensive.
That is absolutely beautiful. I am very sure, as this gets around, as it will, that people are going to have questions. Okay, people can contact me. They just have to go to drjessarmine.com, and you'll see you'll be able to make a 30-minute complimentary appointment if you feel like I can help you. But Emma, can people get in touch with you also?
Yeah, definitely. I'm more than happy to. I spent about a week replying to hundreds of women recently when I
Good,
posted about my
good.
journey. So more than happy to do that. Yeah.
And that's the email address here, Emma
Yes.
at
Essentium.im.
Sentium.im. Okay, great. I was going to look at him like, look like Ascension to me, but
Essentium. Yeah.
Emma, I really appreciate you sharing your story. I know you for a while now. You've been my patient. I also consider you my friend, and I know what is in your heart and what you've done and what you've overcome. And that story will help people live life again, because
Mhm.
there are too many people who are told and who are living the disability and not living their lives. And they want to live their lives. They just don't think there's a way out.
I know. And that's what we've got to change.
And we're well on our way, especially with people like you. So, guys, if you'd like to contact Emma, it's Emma at Ascentian.im.
.im.
Okay. If you'd like to ask me questions, it's drjessarmine.com. And thank you for listening. I hope that you
Thank
learned
you.
something here. And Emma, thank you so much for sharing your
Thank you very
story. I
much. Thank
appreciate
you.
it. Okay. Bye
Cheers.
bye.